Go.
Good morning, everyone, and thank you for joining us today in this session on cervical cancer by the Global Health Society of GAIMS. At GISOG, we aim to do our part to improve worldwide health, access to healthcare services, and the quality of healthcare for all, while educating medical students on important aspects and giving them opportunities to explore. On the Cervical Cancer Awareness Month, we planned this session. As we all know, cervical cancer is messy and scary. You throw everything at it, and it turns out that might be the best weapon of all. We have the national president of GAIMS with us, Tarun Kumar sir. What is GAIMS? I'd like to tell you that Global Association of Indian Medical Students is a think tank for issues of medical education to provide efficient education to all Indian medical students to be the best in the world by working with all government, private deemed autonomous medical institutions and colleges, academicians, and leaders. You can follow us on YouTube and Instagram on the following links. Stay updated. From here on out, I will give it to my team, but before that, we'd like to tell you what all we're going to discuss today: the causes of cervical cancer, the symptoms, diagnosis, how to prevent it, and how to treat it. From here on out, Janvi, you can take the stage.
I will be introducing cervical cancer. Next slide, please. Cancer, a disease in which cells in the body grow out of control. The cervix connects vagina, that is the birth canal, to the upper part of uterus. The uterus, or the womb, is where a baby grows when a woman is pregnant. All the women are at a risk of cervical cancer. It occurs mostly in the women over the age of 30. Long-lasting infection with certain types of human papillomavirus is the main cause of cervical cancer. HPV is the most common virus that is passed from one person to another during sex. At least half of sexually active people will have HPV at some point in their life, but very few women will get cervical cancer. Cervical cancer is preventable and curable as long as it is detected early and managed effectively. Yet, it is the fourth most common form of cancer among women worldwide, with the disease claiming the lives of more than 33 lakh women in 2018. Next slide, please. 6 lakh and 4,000. These are the total number of new cases that were seen globally in the year of 2020. 32 32,400 were the total number of deaths that were seen in the year 2020. Next slide, please. Let us now look at the world statistics on cervical cancer. Almost all cervical cancer cases, that is 99% of it, are linked to infection with high-risk human papillomavirus, as I've just spoken, and it is an extremely common virus transmitted through sexual contact. Although most infections with HPV resolve spontaneously and cause no symptoms, persistent infection can cause cervical cancer in women. Effective primary, that is HPV vaccination, and secondary prevention approaches, that is screening for and treating precancerous lesions, will prevent most cervical cancer cases. When diagnosed, cervical cancer is one of the most successfully treatable forms of cancer as long as it is detected and managed effectively. Cancers diagnosed in late stages can also be controlled with appropriate treatment and palliative care. From now on, I hand over the mic to Sayed.
Next slide, please. Now we'll discuss the symptoms of cervical cancer. Early cervical cancers usually don't cause us any symptoms. Next slide. The usual symptoms of cervical cancers are vaginal bleeding. It's the earliest symptoms and most commonly occurs post-coital, and copious or purulent vaginal discharge, pain during sex, or pelvic pain, or there can be maturation symptoms like dysuria or hematuria. Next slide. Symptoms of advanced cervical cancers includes anemia, fatigue. This is due to the chronic blood loss due to vaginal bleeding, or anuria. This is due to the cervical mass blocks the ureter, which causes pressure buildup in the kidneys and ultimately resulting in renal failure. There could be rectal bleeding due to fistula formation and constipation due to obstruction. Next slide. Now we'll discuss the causes of cervical cancer. Next slide. The most common cause of cervical cancer is HPV infection. HPV stands for human papillomavirus. HPV is classified into three categories based on its carcinogenic potential. First category is carcinogenic. It includes HPV types 16 and 18, and probably carcinogenic. It includes HPV types 31 and 33, and possible carcinogenic. It includes all the other types of HPV except 6 and 11. 6 and 11 generally causes genital warts. Next slide. The other risk factors of cervical cancer includes smoking, long-term use of contraceptive pills, positive family history, multiple pregnancies, multiple sexual partners, altered immune status as in AIDS, and low socioeconomic status. Next slide. Now we'll discuss the pathogenesis of cervical cancer. Since most of the cervical cancer are associated with HPV infection, I will discuss HPV infection to cervical cancer. So, HPV infection generally causes two types of lesion. The most common type of lesion is squamous intraepithelial lesion, in which dysplastic squamous cells are formed. If it is caused by high-risk HPV and there are associated risk factors are present like smoking or use of contraceptive pills, it results in formation of invasive squamous cell carcinoma. Very rarely, low-risk HPV can also result in invasive squamous cell carcinoma. And the second type of lesion is glandular intraepithelial lesion, in which dysplastic columnar cells are differentiation occurs, which in presence of associated risk factors, it forms invasive adenocarcinoma. Invasive squamous cell carcinoma is generally the most common. It includes 85% of the cervical cancer. Next slide. This diagram shows the progression from normal cervix to cervical cancer, in which first HPV infection occurs, and CIN1 stands for cervical intraepithelial neoplasia 1, in which 1/3 of the epithelium is dysplastic, and CIN2, in which 2/3 of the epithelium is dysplastic, and then CIN3, which includes the whole of the epithelium is dysplastic, and then carcinoma in situ, and then invasion occurs as cervical cancer is formed. Now Surya will continue. Next.
Now coming to the diagnosis. Next slide. First is pelvic examination, in which the doctor checks for any unusual changes in the patient's cervix, uterus, vagina, and other nearby organs. Next is pap test. In this, cells of cervix are scraped off and they're sent for microscopic examination. Next. Next is HPV typing test, then colposcopy, imaging studies like X-ray, CT, MRI, PET scan, serum markers like SCCS, CA125, and CEA. Biopsy, there is endocervical curettage, in which a small spoon-shaped instrument is used to scrape off tissue samples from the cervix. Then there is loop electrosurgical excision procedure. And there is conization. Next. Coming to prevention. Next. What reduces likelihood? Exercise, vaccination, test, and doctor. Next. HPV vaccine. There are two regimens for HPV vaccine. One is for those less than 14 years, that is 2-dose regimen, 6 months apart. And for those above 15 years, there's a 3-dose regimen. Then other preventive measures are regular screening after the age of 40. That is by methods like pelvic examination, practicing safe sex by use of condoms, quit smoking, reduce the use of oral contraceptive pills, limit the number of sexual partners, less number of childbirth, and late onset of sexual labor. Next, coming to the treatment modalities. So surgery, first is just to cut away the cancer. And then the second modality is remove the cervix, that is tracheostomy. Third is to remove the cervix and the uterus, which is hysterectomy. Then radiation therapy. Radiation can be external or internal. In internal radiation, there's a device placed in the uterus, in the vagina, which is radioactive for a few minutes and then it is removed. This is known as brachytherapy. Chemotherapy uses chemicals to kill cancer cells. These can be taken as pills or injected through the vein. Next is target therapy. Targeted therapy is a type of cancer treatment which uses drugs or other substances to identify and kill the cancer cells. Immunotherapy, it's a treatment to improve your immune system to fight cancer. Last is palliative care. Palliative or supportive care provides relief from pain and other symptoms. So basically, it aims to improve the quality of your life. Now I hand over to Srishti. Next.
Thank you, Surya. In the end, I'd like to introduce our team to you. We have our National Director for GSOC, Shruti Arora. I am the Assistant National Director of GSOC. We had Janvi, Sayan, and Surya, who dictated the slides to us. They're all the national officers. With that, I think we can end the session. Thank you so much for joining with us, and I hope you look forward to more sessions by GSOC and more exciting opportunities.